Back to the Rise to Your Peak podcast. I am here today with my guest, Dr. Ivanna, who's our primary provider and physician's assistant at Rise Health and Wellness. Ivanna, how are you doing today?
I'm doing very well. How are you, Matt?
I'm doing pretty good. I appreciate you taking the time out of your busy schedule to do this video. And I know that
Absolutely.
you've been a little under the weather, but still taking the time. I appreciate it.
Absolutely. Thank you for having me. I'm
So,
excited to be here.
I'm excited too. We've kind of been talking about doing an episode for a while together. And I kind of just want to dive right into it. Just so that, the people know a little bit more about you. You're RPA at the clinic. You're also a national level bikini competitor working towards her pro card. How long have you been actively competing now?
And let's see. I started in 2022, so it's going to be what in 3.5 years.
Wow.
Three,
Yeah.
yeah, three
And
and a
how
half.
long have you been a licensed PA?
I've been a licensed PA for 4 years.
Wow. Okay. So
Yeah.
very, very similar timelines there.
Yeah.
Was your introduction to fitness in that same timeline, or had you been somewhat involved in fitness earlier than that?
I've always been very active in my life. Like I was a professional ballerina and but kind of just stuck with like Pilates and yoga. I
Yeah.
started taking like Orange Theory classes. But I started going to the gym like religiously when I finished PA school and
Yeah.
I started working for a local HRT clinic.
Mhm.
Um, and then my actual introduction to bodybuilding was just to get a better idea of what my patients go through. Because we had a lot of bodybuilders coming in and out of the clinic, and they're
Yeah.
like, oh, I don't feel great. I haven't competed in 2 years. I haven't had a period. I have zero appetite. And I'm just sitting there, I'm like, I can't relate. Bodybuilding was honestly a social experiment turned into a passion. So
Wow.
that's kind of how it happened.
That's awesome. Yeah, I mean that makes total sense. And
Yeah.
you mentioned that, you kind of got started early on in that clinic. Was that your first introduction to healthcare out of school?
So right out of school, it was actually during clinical rotations, I got a job offer to work at an elite plastic surgery clinic in Newport Beach, California. So that's what I did right after school.
Cool. Okay.
Yeah. Yeah. Mhm.
I've talked to quite a few, medical professionals in your shoes, and it's interesting. Most of them kind of go into that, I guess you could say, standardized process of like completing school and just kind of getting, I guess, arguably the best paying job possible, which would most likely be like urgent care, emergency care, something like that, correct?
Yes, absolutely.
And obviously, the ones I've talked to, get a couple years under their belt, decide it's not for them, and then extend their education even further, catching on that they missed a few things in med school and they want to, enhance their skills in practice. It sounds like that may not have been your cup of tea early on. So what kind of led you to not be so interested, or was it just luck of getting that opportunity?
It was honestly a combination of both.
Okay.
I was already very hesitant about what to specialize in when I was in PA school. So when I first started PA school, I was very dead set on okay, I want to do cardiology, I want to do cardiothoracic surgery, I want to be hands-on with the patient, um, and I kind of left it at that. But once we get into school, they teach in PA school, it's based on the medical model. So the patient presents with these symptoms, come up with your differential diagnoses, and then here are the treatments. And I was very fortunate that in undergrad, I did a lot of research on disease prevention and regression for type 2 diabetes and obesity. So I already knew how to fix these common issues, these metabolic syndromes without medications.
Sure.
Yes, medications can help,
Of course.
but we're talking about disease regression and prevention, not putting a
Yeah.
Band-Aid on the
Right.
patient. So
Let me
once
ask you
I'm
real quick, not
yeah.
not to interrupt, but it's pretty common discussions these days of the limitations of med school, and that it
Mhm.
is primarily pharmacokinetics, pharmacology, and symptom management, like you said, or disease management. Um, so I'm kind of surprised to hear that in your schooling there was some nutrition, exercise, and disease prevention discussions. Was that your choice, or was that just the schooling curriculum that they offered?
Well, this was the schooling for my undergrad degree. So actually,
Oh,
and
prior.
yes, so this was
I
prior.
see.
So
That makes more
actually in
sense.
PA school, I'm not joking. And again, this is just my program when I was in school. We had a nutrition and supplement lecture for 1 hour, and it was a 3-year program.
Wow.
Yes. I
Wow.
know a lot of other PA schools that don't even have that.
Yeah.
So very lucky that we at least got an hour.
Yeah.
But my knowledge and my education about disease regression and prevention is from my undergrad studies.
Yeah, that's incredible.
Yeah.
They talk about that more and more. And to some ways, I can understand. Being involved in healthcare, I can understand when you're talking about billions of people, not hundreds of people, billions of people, there has to be standardization of processes to avoid, um, liability lawsuits and unnecessary deaths and unnecessary damage to patients. So, do you feel like that's where a lot of that standardization and kind of black and white comes from? Is like they present this symptom, you present these solutions, and that's it.
Yes, yes. It's very think of it like being like working in a factory. It's like
Yes,
you learn to think like that. You always learn to just think in that method. So and I actually had this conversation with someone not long ago. Um former bodybuilding competitor goes to his endocrinologist and liver enzymes are elevated. Oh, well, what's going on here? I'm sorry, we can't refill your prescription, but they didn't even bother asking, did you work out that morning? Did you
sure,
have coffee this morning? Like what we're not taught to think like that. We're just taught to think, okay, here's a disease, here's a solution.
sure.
Yeah.
Let me ask you this too, since we're on the topic, and I'm curious. I've never asked a medical professional this before, but in a lot of mentorships and continued education programs, one of the first things that they teach in any type of healthcare coaching or anything is interpreting blood work.
Yeah.
So, out of curiosity, what is interpreting blood work? What does the education or learning how to interpret blood work look like in actual med school or PA school?
Okay, so this is fun. Okay, so they give you so obviously you get a whole list of all the markers that we can test for.
Okay,
The standard one, so CBC with differential, CMP, which includes your electrolytes, organ function, and thyroid. And then we go into the more like specialized ones. So for example, hormones,
sure.
thyroid, sex hormones, not all of them.
Right.
And then for like autoimmune disorders. Anyway, so they give you this whole list and they tell you, okay, this is the normal range. So anything within that normal range, they're good. Anything higher means it's this, anything lower means it's that.
So they are giving a little bit of cause and effect.
Yes.
Okay,
Yes. Yes. So they do give you, so they want you to think like, okay, well, if you see this type of pattern, um, think this disease. Or if you especially like for example, like with the thyroid hormone panel, because things can are up and down. They do want you to be able to look at this and be like, okay, well, if it's slightly out of range, it's most likely this thyroid
Right.
is. So that's just a super easy example. So they do
Sure.
give you some background, but they just kind of leave it there.
Is that because, like, as you progress in school, you move into, we call it silos, you move into a specialization, and the idea is, well, as you get into that specialization, you'll learn more about those lab markers. And
Yes.
so it's like baseline knowledge, specialization. But if you're looking at cardiovascular health, you're not gaining the hormone knowledge that an endocrinologist would have.
Absolutely. And the great thing about PAs is because in school we are taught everything, we don't have to specialize, unlike doctors or nurse practitioners. So we can switch and rotate specialties whenever we want. And
Interesting.
that's when furthering your education, for example, if someone decides to go to make the switch from cardiology to women's health, then you have to catch up on your education and then learn as you go. But we have a basic sense of knowledge and understanding about everything.
Very
And
interesting. Would you say because of that, uh, have you noticed that PAs are more often involved in alternative medicine and preventative healthcare models because of
I,
a more
yeah,
broad approach?
absolutely. I actually know a lot more PAs that go into family medicine because it's general medicine.
Yeah.
And then you also do have those who want to specialize in something because that's just what they're passionate in.
That's
But
actually going to be a question of mine is the desire to specialize truly passion? Is there monetary incentive to being a specialist? Obviously, you're going to make more money.
yeah, absolutely. Yeah.
Yeah.
Passion, more money, everyone
Yeah.
is different. Everyone has their own response.
Yeah.
Yeah.
Yeah, I think the down and all that makes sense. And I think it's unrealistic to say there should be no standardized process.
Hmm.
At the same time, I think that in some realms of, the brick and mortar healthcare model, they kind of tell you like put your head down and just do what you're told and almost penalize you for thinking outside of the box. It's like if you start thinking outside of the box, if you talk too much about nutrition, too much about supplements, our umbrella of protection over you dissipates.
Yes.
Liability lawsuits increase or risk thereof because you went against the standard model.
Well, you also, yes. However, you also have to think about it in the sense where, unfortunately, and I'm not trying to attack the American population, we want answers and solutions now.
Yeah,
So giving you the pill is going to give you that solution right now. And I've had patients who come in and tell me like, okay, well, I want to do this. I want to take my time. And I'm like, okay, well, define I want to take my time. And they're like,
right.
oh, like a few weeks. Like, oh, honey, it doesn't work like that.
Right.
So we can give solutions to the patient, but a lot of the times I've just noticed that they just want the easy fix. They
You're
just
so
want
right.
in and out and call it a day.
You're so right. We
Yeah.
can talk poorly about how the system sets you up to only have 10-minute visits with your provider, but on the whole other side of that, there's the person who literally only wants to spend 10 minutes, get what they think they need because some pharmaceutical commercial told them they can lose 20 pounds or fix their anxiety. And they're so emotionally tied to this idea that no, 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 this is going to fix me. Just give me this.
Yeah.
They're looking at the doctor as, I don't want your opinion on how to help me. I want you to prescribe me what I told you to prescribe me.
Yes.
And I can wholeheartedly understand that if you're passionate about helping people, sometimes you put a boundary, you put a wall and say, no, that's not what you need. On the other hand, sometimes the best way to help a person is to compromise and find a middle ground. And like you said, maybe they're not ready for the truth. Maybe they're not ready to dive into that root cause. But if we can just help them a little bit and they'll come back in 60 days, maybe then they'll be ready.
Yes, and I've even noticed from my personal experience when you walk into a doctor's office and you say, okay, well, I'm here because I have low sex drive. I already know I need testosterone.
Yeah,
But then we're looking at everything else and we actually start talking about their lifestyle where they get zero sleep, they barely eat.
yeah,
Um, it's like you have to sort of like slowly like spoon feed, like, okay, here's some testosterone. We're gonna get you that fix.
right.
But there's so many other things that we need to do.
Yeah,
And it's going to complement your TRT.
yeah.
So
I
it's
think it's hard too because let's be perfectly honest, if we're talking, PCPs or GPs, if you don't give them the answer they want, they're going to three others and getting what they want the same day.
yes,
So even if you were like, look, come back in a month and we'll talk about how sleep and diet worked, they're never coming back. They're going next door to the next doctor and getting their prescription. So it's very hard to have that trust and comfortability of like, let's work together on
yeah,
this. And I
yeah,
do think that's where some of the colleagues that I've done podcasts with, they've moved into family practice where they're much more one-on-one and there's like a trust and a bond, how it used to be, physician and patient of like, you're not going anywhere else. Let's talk through this and we'll meet each other where we are, you know?
yes, absolutely. Hmm.
Why do you think it's just population that kind of changed that model from like that intimate family doctor who takes care of the whole family and they all know each other and stuff? Is it just so many people now that
I,
it's just too crazy for that?
yeah, I think so. And also looking at it from pretty much the reason why PAs were made was because there's a huge gap between doctors and nurses, especially back in the day. And there's just not enough intermediate people who can help the amount of people that need help.
Yeah,
So the shortage in medical providers is kind of like what led to those 10-minute appointments, 15-minute max.
yeah,
But that's why PAs are here because we're here to facilitate and help recreate that bond that was lost from the shortage.
totally. Yeah.
Mm,
I think
yeah.
there's obviously an argument there that, both healthcare shortages and the healthcare insurance issue and the chronic disease issue, they're all interconnected.
Yeah.
If we could reduce America's chronic disease in half,
Mhm.
the cost of insurance would also go down because the
Yeah.
cost of care would be going down, and the limited healthcare professionals wouldn't be such an issue.
Yes.
So it's like, well, we have
Like
all these
doing,
symptoms, but the
uh,
problem is we have too much disease.
yes, we have too much disease, and I'm literally just like moving on my seat, thinking like, oh my God, but insurance companies and pharmaceutical companies, they love making money.
Yeah.
That's
I
that's
tell people,
something
it's
too.
I think people are still unaware. I think since 2020, almost no one can argue that, Big Pharma is the good guys. But I think most people haven't caught on that insurance is just as bad as Big Pharma.
Yeah, they're
These are
everyone's
two peas in a
in
pod working against
competition with
us.
each other. Absolutely. Yes.
They're BFFs
Yeah.
just talking and whispering, how can we make more money with
Yes.
with this nation?
Yes. And something that just blows my mind, especially with insurance companies, is and this is also just another reason why I didn't want to go into like traditional medicine or just a regular specialty within medicine, is because they dictate what we can and cannot prescribe.
Absolutely.
I'm like,
They
I'm sorry,
handcuff you,
are you with the patient? Do you know what they need?
right?
So,
Well, and it
yeah,
gets it gets so much more. You can just eye roll at it constantly because I'm obviously from like an outsider looking in, but I have some really good peoples. So like I can see that. yes, prescription limitations due to insurance are a thing. Diagnostic testing limitations from insurance are a thing. And then when you learn that they're setting standards of testing specifically to prescribe certain medications, it becomes even more annoying and frustrating. Great example,
Yeah.
fucking TSH. TSH is only tested to prescribe Synthroid.
Yes.
That's the model.
You're lucky if you get T4 in there in the blood work.
Right. And to that
Yeah.
point, T4 would actually prevent them maybe from prescribing Synthroid. So it's like, they do everything so ass backwards. And I tell people too, we've come to a time where everyone is fixated on the labels for their disease and dysfunction. Whether we're
Yes.
talking about insulin resistance, PCOS, Hashimoto's, they are just so fixated on these labels. And it's
Mhm.
just like, if you only knew that the purpose of that label is medical coding and has no other merit, none
Yes.
whatsoever. And I really learned that honestly through working with you and having to fucking prior authorizations. That's
Yeah.
how I realized this is all a scam and it's just labels for coding.
Yeah. Yeah.
Because we'll have someone with tons of infections and, we'll try to prescribe them rifaximin, for example. And they'll be like, well, have you tried these other anti-diarrhea drugs first? No, they have infections. Why would we be taking anti-diarrhea drugs? But it has nothing to do with actually fixing the patient's problem.
Yeah.
It's just go through the rule book, go through the standard process, and if you haven't done that, we're denying it.
Yep. Yep.
Pretty unfortunate.
Oh, gotta love medicine.
Do you currently have health insurance?
I do.
You
I do.
do.
For tax purposes, though. Do I use it? I do not.
Yeah.
Yeah.
I honestly haven't had health insurance in, I want to say close to 5 years.
Yeah.
Now, granted, these days I'm fortunate enough to have providers in my back pocket and low cost testing to a degree, but even removing all that, I can think of a few examples living back in Wilmington that something came up and I had to go to urgent care.
Mhm.
And not having insurance, I paid 5 times less than if I would have had insurance. What am
Yeah.
I missing here?
Yeah. I
They
think
wanted me to pay 600 a month for insurance and then pay co-pays, and now I pay nothing.
yes. I think with insurance, it really comes in handy when actually something bad happens. So I actually had a really bad health scare earlier this year, and I was hospitalized for about a week. And I'm not joking. This is when I'm like really, really, really happy that I had insurance. My payment for the hospital went from like 50K down to 10K.
Wow.
So thank you, insurance. So, but that's the thing. It's like
It's like
I
the
insurance,
unforeseen emergencies is when
yes,
you need it.
it's exactly, exactly. But other than that, like I go to my primary once a year. I get my blood work, my testing, and okay, cool. Here's my co-payment and that's it. But I do
Yeah.
it just to meet my personal quota.
Yeah.
And you know this about me. When I look at my own blood work, I'm like, oh, I'm fine. But that's why I send it to you because I need someone else to kind of
Yeah.
take reins in my health.
Sure. Yeah. I mean, I do the same thing to myself. We all kind of need someone else just to kind of be that continued advocate for our health, you know? And I totally get that. And my mom always argues the same thing. She's like, what about an emergency? It's like that, God forbid something big happens. It's not hundreds of dollars, it's hundreds of thousands of dollars. And that is truly where insurance comes in. I think though, it's all too it's all too mixed up into a pot and it's too messy. I
Yeah.
feel that okay. that there's valid arguments for emergency insurance, but you're not covering my preventing of disease.
Yes, and
So maybe we should split this up, call it 50-50, and cut my payments in half, and I'd be willing to do that, you
you
know?
know, that actually that reminded me. So when I was in Boston for school, I got my health insurance there. They had an incentive program where they will pay for your gym membership. And
Wow.
I'm over here back in California, and I'm like, can I get reimbursed for mine? It's not
Right.
even an option.
Wow. So is that a state thing?
I it, it, I don't know. I don't know if it was a
Interesting.
state thing. I don't know if it was just because I was in that specific health insurance plan.
Right.
It's just crazy how things like that, in my opinion, it should be nationwide.
Totally. Well, and I know that I haven't heard much of it since, but prior to this past administration getting into office, I know that RFK and the people following RFK were really pushing for FSA and HSA to start covering a lot more.
Yes.
Even like organic food, supplements, gym memberships, which it should. Flexible healthcare spending, that's what it should be. I just haven't heard much else about that, if that's continuing or becoming mainstream. But that's something we've always done at the clinic is, made sure anyone's services could be covered through HSA or FSA, because you're directly putting money into that account. You
Yeah.
want to make it worthwhile.
Yeah, absolutely. And in my two previous jobs, we had the exact same option for our patients.
Yeah.
And even when I'm like browsing on Instacart, like you see like, oh, FSH, like I lost that word, but you know what I'm trying to say. Like
Yeah.
it's there. It's
Yeah.
there. And I think it would be a really good idea that people are educated about that. So it just it's just there for you. It's beneficial.
Well, and I think, I don't know, I guess more independent millionaires and billionaires need to involve themselves because obviously, even what we're talking about now, that hurts the business model of insurance and big pharma.
It does. It does.
Organic food, exercise, less likely to need medications.
Yes. Yes.
So it's a tough world out there.
Yes, it is. It's a monopoly.
So, I understand you had a little bit of a rockier road this year with competing.
Yes.
Um, you had to kind of pull back from your plans this year. Life was just kind of getting the best of you.
Yeah, life was just lifing right
Yeah.
there. Yeah.
I mean, we have to think you're a full-time doctor. You're
Yeah.
trying to become a professional athlete.
Yeah.
You're also an adult in 2025, arguably the most stressful time ever. So
Fabulous.
that's a lot to handle.
Yeah. Yeah.
Even with you, which by the way, I admire your choice
Thank,
to pull out.
thank
That's
you.
never an easy choice to make. And emotionally, especially 4 to 6 weeks out, emotionally, you're like, am I just being a bitch? Should I just complete this? Like, should I just trust the process and keep pushing myself? Or should I listen to the 10 check engine lights, realize this isn't good timing, and pull out? Very hard decision to make.
Yes.
Um,
Because it wasn't the decision I wanted to make, but
sure.
it takes a lot of strength and courage to kind of take a step back and say, you know what? It's okay. Right now, in this very moment, it is not my time. I'm not saying I'm stepping away from a dream of mine. I'm not saying I'm never going to do it. I'm
Yeah.
just saying right now, my life and my health, my mind, my spirituality, my energy is more important
Yeah.
than competing. And so, um,
Well, and you're still young.
yeah, yeah,
What's the difference now versus next year? You know what I mean?
exactly,
It's not like
exactly.
it's going away.
Yeah, the state is
Um,
always there.
yeah, exactly.
Mhm.
This choice, when you made it, was this something that you leaned into support systems and people to kind of help you make this choice, or was this pretty much on your own internally that you made this decision?
So I made the choice. It was an internal choice that I made. So when I did, I was going through an unexpected breakup.
Hmm.
And I'm the type of person that once my mind is set on something, like nothing can get in my way. That is why I'm
I can
here
see that
today.
about you.
That's literally been my life motto. Like nothing
Yeah.
gets in my way. But I started now, and obviously this being on prep, that this wasn't my first time. So I know when I feel off because of prep, and I know when I feel off because of other things.
Sure.
So I could literally be doing lateral raises at the gym, and I would just start crying.
Ooh.
So I'm like, okay, it's not because I'm tired.
Right.
It's because, I mean, I'm hungry, but it's not because I'm hungry.
Yeah.
Um, Something like I'm losing that fire that I'm so used to having.
Yeah.
And I remember waking up the morning of Thanksgiving. I sent my pictures to my coach and I just looked at them and I said, okay, I'm 2 weeks out. Mentally, I am checked out.
Hmm.
I can get there. I can get to the finish line. I know myself. I can get there, but
Yeah.
mentally, I'm checked out.
Yeah.
Emotionally, I'm checked out.
Yeah.
Um, my heart isn't there.
Yeah.
And so I drive to the gym and I'm just sitting there waiting for one of my friends. And he walks in and I just start crying. I said, I don't know if I can do this. It's okay, let's talk about it. Let's talk about it.
Yeah.
And it's been such a big help, huge support system for me. And he tells me, okay, well, let's kind of talk about everything.
Yeah.
And I knew deep down because I woke up that morning with that feeling that choosing to not do nationals was the right call.
Yeah.
And usually when I decide to drop out from a show like I did earlier this year because of my health scare, I would literally just be on my phone looking at all the girls compete, feeling so sad and so bummed out.
Yeah.
But this time around during nationals, I was okay.
Wow.
That was just a confirmation that I needed to say, you know
Totally.
what, right now was clearly not your time.
Totally agree.
And being in the middle of all that, of course, like you don't want to see what comes next. You don't want to see the future. You don't want to like you just want to call it quits.
Yeah.
But you know what? I'm so happy and so excited that I was able to kind of just like sit in the storm,
Yeah.
let things settle down. And I'm so excited to have my very first structured off season with my coach. It's just gonna be amazing. Like I'm
Yeah.
I'm so excited. I'm
Yeah.
so excited. Yeah.
Well, that's fantastic. And I do agree that, and we've talked a little bit since your
Yeah.
decision, and it's very clear that one, it was the right choice, and everything since then has just confirmed that for you.
Yeah. Yeah.
So I'm proud of you for that, and I'm glad that you're in a good mental space after the fact. So let's talk a little bit about your plans going forward. So you guys
Yeah.
have started a productive off season already?
Yeah, so I'm still in the process of reversing.
Yep.
So pretty much with the reversing out of a diet phase, we're trying to ramp up the metabolism as high as possible, limit cardio as much as possible. So when prep does come around, we are at a good starting spot. So I don't have to be on super low calories or crazy
Right.
amount of cardio. But even then, like my coach is really smart about his approach. After a certain amount of diet and cardio, he has a limit. So
Sure.
he doesn't burn his girls to the ground.
Yeah.
Unlike fortunately, unlike a lot of other coaches.
Yeah.
Um, so I'm still in my reverse. And I just because I like having a timeline, I asked, like, okay, well, like, how long are your girls on off season for?
Yeah. Of
Everyone is different, of course,
course.
but we're thinking, I don't know, late spring. So I'm like excited. So
Okay.
we'll see. We'll see.
I'm guessing, based on my opinion of your physique and stuff, I'm guessing there's not really much time needed for like growth, so to speak. It's more so just building metabolic function
Yes,
and getting
yes.
you in a good place to compete.
Absolutely. And something I've even noticed after my health scare is how much my body just did not want to absorb nutrients. So
Mm,
I was on antibiotics for about 3 weeks straight.
wow.
So I noticed just how much that affected me.
Yeah, yeah,
Yeah. So I would eat my protein and I'd gain fat. So it like my body was just not happy.
yeah,
And so at least like for me, it's restart, like you said, restarting that metabolic health, but
yeah,
also just making sure my gut is healthy. So prep is just smooth sailing because once I'm like 110% in
yeah,
it, my diet and my cardio and my training,
yeah,
my body responds super quick.
yeah.
Yeah, I need that reset for everything.
With your experience now being a few years into competing at the national level, I'm sure you've connected with tons of women, whether it be at the gym, backstage, part of your teams, etc. Um, are you, what are you catching in terms of like what's the talk around? Like, do you feel like a lot of women have a pretty good idea of taking care of themselves health wise these days and due diligence in terms of before they hire a coach, before they start prep, priming their bodies, or is that still pretty like upper level knowledge to expect someone to have?
So I do think there's coaches that I talk to that highly recommend doing blood work before starting any sort of cycle or starting prep or even starting an off season,
Yeah,
just like a baseline
yeah,
of what needs to be fixed or what's gonna be changing. But there's also other coaches who kind of just say like, okay, well, I mean, here's a list of markers, like go have fun, like get it
yeah,
done. And then that's when I have girls or even men, like male competitors, come and talk to me, and they're like, "Okay, well, this is like I need help," and I'm like, "Okay, well, what stage are you
right.
in?
Yeah,
When was your last injection?"
right,
Um, and I'm just sitting there, I'm like, "You're in the middle of prep, like." You're not going to be starting anything. You're not going to be changing anything. Like I can't guide you in any way, shape, or form.
right.
But the coaches who do recommend and they sit down with you and look at your blood work, they just want to make sure that you're at least like within normal, healthy
Of
ranges.
course.
Yeah.
Do you think from a female competitor standpoint, what are some things you think could improve in terms of just the talk around the town, knowledge base, expectations? Since you're backstage, you're in the gym, what do you feel is like missing these days in terms of just women's knowledge, female competitor knowledge? What are some insights through your experience that you feel, man, I really wish more women knew this?
When to get their blood work done.
Okay.
Yes, because I have women who go at random times during their cycle. They're like, "Oh, I'm estrogen dominant," and I'm like, "Okay,
Yeah.
let's define that."
Right, right.
Um, and then, like I said earlier, there's patients, I have girls who go when they're like deep into prep and they're like, oh, my hormones are suppressed.
Of
Yes,
course.
supposed to be
Right,
your prep.
right.
Um, so it's just timing of blood work, really.
Yeah.
Yeah.
Do you think for the most part in 2025, 2026, there's not many people arguing the that blood work is unnecessary? Like it's pretty common knowledge these days that
Yeah.
you get blood work at the start of working with a coach. That's a pretty standardized conversation these days.
Yes, absolutely. I've noticed that a lot of coaches are now actually taking their athletes' health into consideration.
Yeah,
Um, I haven't been in the bodybuilding sport for so long. It's just
right.
3 years. But even going into my first prep, I was told to get blood work done.
Yeah.
But I heard that wasn't a thing 6 years ago, you know? So a lot of coaches are
Exactly.
now, yeah, a lot of coaches are now telling their athletes to go get blood work done.
Yeah. I honestly, it's been a slow progression, but like I can think back to in 2018, no one was talking about blood work. So I can say that confidently that 7 years ago, no one was talking about blood work. And when I say no one was talking about blood work, I'm not even just saying like coaches weren't recommending it. I'm saying nobody was on Instagram interpreting labs. No one was talking about reference ranges. I think a lot changed after like lockdowns, 2020.
Mhm.
And one thing that I noticed just in my own experience, because there was nothing to do, I just dove into education and research. I did online courses. I just continued my education because what the fuck else were we going to do during
Yeah,
lockdowns and stuff?
yeah,
So maybe that was part of the shift. And maybe it was just people finally catching on that. Well, metabolic dysfunction relates to hormones and stress. And so if we don't check the hormones and stress, we're never going to know about the metabolic dysfunction.
very much.
And so I guess common sense was just injected into bodybuilding.
Mhm.
But yeah, it's crazy that you've only been in it for like 4 years. Because let me tell you, if you had been around 10 years ago, you'd be like, what the fuck
Yeah,
is going on?
trust me, I've been told. One of my
Yeah,
friends has been competing since he's like 15 years old, so he's been through it all.
yeah, it was so crazy back then.
Yeah, yeah.
Um, so obviously aspirations for the future. Let's talk about career goals, life goals, everything. What are your aspirations for the next few years?
Oh my goodness. Well, I'm extremely passionate about education and sharing knowledge. So I do admit I've been slacking with my content, but it's something I'm passionate about because I just want people to be informed.
Yeah.
So whether that is eventually being invited to speak in a conference and share my knowledge.
Yeah.
But yeah, education is one of my passions.
I love
Uh,
that.
Continuing with Ryze, of course,
Yeah.
continuing my education. It's honestly a blessing to be where I am today. So I have you to thank. So thank you,
Wow.
Matt.
Well,
Um,
I'm equally as thankful that we connected, years ago, and that you've been able to, come on full steam with our clinic. Um, I think the education aspect is so important, and
mhm,
I think in bodybuilding, I can understand how there's arguments for coaches to be like, well, I don't want everyone to have that education because that takes away from my specialty in getting clients, but where we are there's so much disease. Like, I can't even say, give me all the clients. Like, please don't. So I'm kind of in the same boat where it's like, well, I'm sharing education so that more people have skills, so
mhm.
that it doesn't feel like I'm alone on an island fixing people. You
Of course,
know,
of
if
course.
we can help five other people actually understand what autoimmune disease is,
Oh
then
my
that's a
gosh.
win. If
That's
we
a
can
whole
help
other
people,
podcast in itself.
I know, but if people can just start using their brains a bit more and
Mhm.
get out of this fixation of labels and fixation of symptoms and use some deductive reasoning and connect the dots, I truly feel that that's where the bigger change comes in. Because there's a lot of functional coaches, there's a lot of lifestyle coaches, but they're missing the mark.
Yes.
I see
Yeah.
functional coaches every day talk about, I helped this girl manage her high blood sugar with carb cycling. Okay. How about you fix the high blood sugar though? Like we're just managing it. And I mean, I could go on that soapbox all day, but I fully agree with you that I think getting educational content out is arguably one of the best things we can do to continue helping society from a health standpoint. Obviously, you and I are directly helping people, but that's limited. How many people can we help in a day?
Yeah,
if we can get word out to thousands of other coaches and medical professionals, PAs who are open-minded, NPs that are open-minded, we can slowly shift that discussion away from disease management to disease prevention even more.
absolutely. And I've seen some great videos on Instagram and TikTok.
Yeah.
Very accurate, very entertaining to watch. It gets the point across and it's accurate. But there's also some videos where I'm just sitting there like, oh, I need to fact check this because now I'm even questioning my own knowledge. And unfortunately, I would fact check and I'm like, oh, that's not right.
Yeah, yeah.
Yeah. So,
It's tough too because some people have just learned to speak with such conviction.
yes.
And so like you said, you're a medical professional and you even had to question like, wait a minute, is he right or am I right? Let me go look
So
into this.
yeah, so this is actually, I don't remember who made this video or exactly like what was discussed, but the person speaking was talking about how estrogen therapy in men is beneficial.
Hmm,
It helps
interesting.
with A, B, C, D, E, F, G, like
Yeah,
the list goes on. And he listed the study. So I click on the study and I'm reading it and I'm like, there's nothing about estrogen therapy. It's testosterone. It
which
was speaking.
raised the estrogen.
Exactly. And I'm like, this is a study about testosterone. And he made it seem that estrogen therapy, like for example, giving estradiol to a man is going to help.
Crazy talk.
I'm like, okay, I mean, yes, he's right, but
Right,
no, he's not.
right.
And this is
Wow.
the
Yeah,
importance of knowing how to actually do research,
yeah,
extrapolate the research and share it to the public. That's a skill in itself.
yeah, totally.
So that's kind of like what I want to do. I want to educate the public.
Yeah. And
Yeah,
educate them in a way that it's so simplistic that they can't get it wrong.
exactly.
That's like always been my thing. When I've done mentorships and courses and stuff, how can I break this down so it's impossible for them to get this wrong? The
Yeah.
most simplest terms possible. I think too many people on social media, they're trying to sound smart. So they use big words. They use, the what the
Words. Yeah.
medical
Medical
research
terms.
book your
Yeah.
medical journal said, and they're
Yeah.
just regurgitating it. But it's like I have no fucking clue what you're saying right now,
Yeah.
because I don't speak that verbiage.
Yeah. Yeah. And especially for the lay readers,
Yeah,
the everyday people, they
attorneys
need,
do the same thing. When I've talked to my lawyers about something, I'm like, fucking say that to me like a normal person,
and
dude.
you're like, I'm 5 years old. Explain it like I'm 5 years
Yeah.
old.
Am I
Yeah.
getting sued or not? Just tell me.
Yes. 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 Exactly.
Um,
Exactly.
But yeah, no, I think that's another important thing is not just giving out good information, but being able to break it down in a way that anyone can understand.
Mm-hmm. Mm-hmm. Absolutely.
One thing I'll say, kind of contradicting the spread of education, I see it as a double-edged sword. I'm a little concerned with the introduction of ChatGPT as a medical reference and diagnosing disease. How much have you heard about this, witnessed it, etc.?
So I don't go on ChatGPT to kind of look up my symptoms. So honestly, I've never used it for that, but I have heard that they're gonna stop doing that.
Hmm.
I
As
don't
in
know.
ChatGPT is not going to do it.
Yeah, they're gonna be like, there's gonna be some sort of like pause on giving medical advice.
Interesting.
Or I heard about it. I actually I did not like actually look into it. It was
Yeah.
just something I heard. Um, but the fortunate thing is that there is a chat GPT specifically for medical providers, meaning you need your
Interesting.
license number, your MPI
Really?
number. Yes.
Wow, I didn't know
I
that.
haven't played around with it, but I have it on my phone.
Wow. Okay.
Yeah. Yeah. So
Is it
there's
called
access
Dr.
to it.
ChatGPT? Like what's it called?
Oh my God, let's see. Um, what's it called? Open evidence.
That's cool. Open
Again, I
evidence.
haven't played around with it, but when I signed up for it, I had to put my medical information on there and actually get verified. So it's not open to the public.
Wow.
Yeah.
We'll play with that. Well,
Yeah, let's play around with it.
let's experiment with kind of information. That I think isn't bad. I think having backup info, as long as it's correct, to providers makes sense. What I've been hearing about lately is you go to a doctor's office, they give you a diagnosis, a breakdown. You then check ChatGPT and argue with the doctor and say, no, it's this. And what I've heard is ChatGPT ends up being correct more often than the doctor. But I think there's so much context that that's not a fair statement to make.
Yes, yes, yes. I mean, it would have to be a case by case basis, but I have heard that they're not going to be able, that ChatGPT will not be able to give medical advice anymore, medical
Wow.
and legal advice anymore.
Wow. The legal
It,
advice I have used every now and then. So that's interesting. I wonder if it's strictly liability or if there's like pushback from medical organizations, legal organizations. I wonder what that is.
I mean, it could be a combination of both.
Yeah.
We're always in school, we're always taught to think that it's a liability issue, that it's some
Yeah.
sort of like you're gonna get sued.
Yeah.
So, yeah, I mean, that's just how we think.
Well, I mean, and it's not false that, liability lawsuits are happening every day. And I think with the economy where it is, people are suit crazy. And so like that's not a inappropriate fear to have. But it's also worth mentioning that I think the younger generations, your generation and down, is a very DIY generation where it's like, I don't need college. I'll just go on YouTube. I can perform my own surgery. I can be my own dentist, like it's a very I got this mentality. And I think AI is just on steroids, like just enhancing this I got this mentality.
Oh my God, yes. And I mean, you even see it in the bodybuilding community with like with young people who want to start their first cycle. And I'm all of a sudden I'm just hearing like, oh yeah, like I'm gonna be running like 500 of EQ and I'm just sitting there like, oh my God, like who gave you this advice?
Oh
And
boy.
it's just it's out there. This
Yeah.
information is out there.
Yeah.
So education is super important.
Yeah. So crazy.
Oh God.
It's hard to argue though, like everyone knows real legitimate education is important. But then when we've had so much distrust in the education systems, the government systems, the healthcare systems, that's a hard argument.
It is a very hard argument. And unfortunately, too, with the American mentality that, I mean, look at our food, everything is
Yeah.
sized. So
Yeah.
everyone thinks like having more is going to lead to more results.
Right.
So yeah, there's there's a lot of cleaning up we need to do.
There is. There sure is.
Hmm.
I am just realizing what time it is. We've been chatting for a while. Great topics. I think we
Yeah,
need to set up a second episode,
I love it.
and we'll dive more into some of these things and maybe some other topics. But before we finish up today, I want to give our followers an opportunity to check you out and give you a follow. So where are the best ways that people can connect with you, follow you, etc.?
Yeah, absolutely. So Instagram is always the go-to. So it's at first name, last name. So IVANNAFUXKAHN. Yeah, that's my name. I'm very uh, yeah. I mean, everyone has their name on Instagram, so that's
Yeah.
me. Yeah, follow me if you want to chat about what was discussed, or even topics that you want me to cover, like just send me a message and I would love to chat and educate you on whatever topics you have in mind.
And if you guys need any medical assistance, Ivana is our primary provider at Ryze. So
Yes,
come on over and we'll take good care of you.
absolutely. Well, Matt, thank you so much for having me. This was a
Yeah.
blast.
Thank you for being on. I know we both got to dive into our days, so
Yes,
we'll touch base. I expect this episode to be up probably in the next week.
amazing. Perfect.
All
I
right.
can't.
Have a great day.
You too. Bye, Matt.